My name is Olufemi Lola Adebusi, and today I'll be providing a brief preparedness training on cholera. You might think cholera, that is a 19th century disease, but let me stop you right there. Right now, as we speak, there are active cholera outbreaks in over 30 countries, including some parts of Africa. And with the global travel and climate change, any health department, including ours, would see a case. So why should you care? Because cholera kills fast within hours if untreated, but it is also entirely preventable with the right knowledge, and that knowledge starts with all of us. Cholera is an infectious diarrhea disease caused by the bacterium Vibrio cholerae, a bacterium that produces a toxin causing the body to secrete enormous amounts of water and salts. People become infected mainly through contaminated water or food. Symptoms include sudden severe diarrhea, vomiting, leg cramps, dehydration, and weakness. In severe cases, patients can even go into shock and die. Fortunately, cholera is both preventable and treatable when recognized early. The population most susceptible to cholera include children under 5 years, older adults, immunocompromised individuals, people living in overcrowded settings with limited sanitation, and malnourished persons. In our clinics and healthcare settings, patients presenting with dehydration, diarrhea, or poor nutritional status are particularly vulnerable. Healthcare workers may also be at risk when handling contaminated stool, vomit, and without the use of protective measures. Cholera spreads through the fecal oral routes. This means individuals become infected after consuming water or contaminated food with feces containing the bacteria. Only infected person can infect hundreds. Sorry, one infected person can infect 100 if water systems are compromised. Contaminated surfaces, medical equipment, or hands can also contribute to the spread if infection control measures are not followed. Poor sanitation, unsafe drinking water, increased transmission risk. Symptoms usually begin with a few hours to 5 days after exposure. Infected individuals are most contagious while experiencing active diarrhea because the bacteria are shed in large amounts in stool. Some people may continue shedding the bacteria for days after symptoms improve, which is why strict hygiene and environmental cleaning remain essential. Cholera is important because outbreaks can spread rapidly and overwhelm healthcare facilities. According to the World Health Organization, millions of cases occur globally each year with thousands of deaths. Public health preparedness is critical because rapid response, early prevention, and infection prevention can dramatically reduce mortality rates. To protect staff and patients, strict infection prevention and control measures must be followed. Hand washing with soap and water is one of the most effective defenses against cholera transmission. Staff should wear gloves and additional personal protective equipment when handling bodily fluids or contaminated materials. Suspected patients will be isolated when possible, and contaminated linens waste must be cleaned effectively using disinfectants. Testing is typically performed using stool samples in hospitals or public health laboratories. The most important treatment is rapid rehydration using oral hydration salts or intravenous fluid. Antibiotics can also be used. Some staff should promptly report suspected cases or clusters to infection control teams and public health authorities. The World Health Organization estimates 1.3 to 4 million cholera cases globally each year, resulting in tens of thousands of deaths. In 2022 to 2024, Malawi had its worst outbreak in decades, over 58,000 cases and 1,007 deaths. The case fatality rate increased to 3% as the expected 1%. Why? That is because of late care, dehydration management, and overwhelmed clinics. That could be also if you are not well prepared. Public health interventions such as water sanitation, vaccination campaign, and rapid treatment significantly improve outcome. In conclusion, cholera remains a serious but preventable infectious disease. Early recognition and rapid treatment, proper sanitation, and strong infection control measures and practicing public health preparedness